Hi, Dr. Tracy Doll here with iDoc Social, and today we're going to talk about the severity of dry eye disease and how we have conversations with our patients to make sure that they're making the best choices. Any patient that I have that comes in who is mild to moderate, I'm absolutely educating that they need to get this under control now, because what we know is that dry eye is both a chronic, meaning it doesn't go away, and progressive disease state, meaning that it can in fact get worse over time. And studies have shown in up to 30% of patients this can be the case. And sometimes getting the ocular surface dryness under control will employ more methods than what over-the-counters can give us, particularly if we have certain risk factors like underlying health conditions or poor lifestyle choices that contribute to it. So if I've got a patient that's using cosmetics that are irritating, if I've got a patient who's vaping, if I've got a patient who's doing elective cosmetic procedures, some of these types of behaviors may be contributing to their dryness and could make it worse. Or if they have a family history of systemic disease conditions that we know can be contributory, it's up to us as physicians to let our patients know that they are at risk for potentially feeling worse over time. Also, the severity can feel different in different patients. We have this area that's innervated with a lot of nerves, and nerves don't always play by the rules. In some patients, it can make them feel hypersensitive. They feel dry even though they don't look that dry. In other patients, they can be incredibly dry but not feel much. And in that case, they can have chronic vision fluctuations and their glasses will never exactly work right. So severity is dependent on each person's body's reaction in their corneal nerves to how they are actually feeling. Sometimes progression can be sensation and sometimes it can be vision. So severity is on a sliding scale for patients. Some people feel it, some people don't. But just because somebody doesn't necessarily feel something as bad as it looks doesn't mean that we don't treat it. Patients don't feel other ocular conditions like glaucoma or macular degeneration, but the visual effects will definitely be there, and that's no different with dry eye. So educating patients that getting this under control in the early stages is super duper important to make sure that they don't be one of those people that progresses. All right, this is Dr. Tracy Doll for iDoc Social. Have a great day.